We're thrilled to have you join us for another inspirational and educational episode of Concorde Conversations. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we all live to our fullest potential. Did you know that heart disease is the leading cause of mortality in both men and women? But our goal is to change that. And so that's why we're having today's episode, Roadmap of Your Heart. Today, we're talking about coronary artery disease and the newest technology to help diagnose it. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group, part of Northwell Health. And today we're joined by our fantastic, amazing cardiology colleague at Concorde Medical Group and faculty at the Hofstra University, Dr. Aeshita Dwivedi. Welcome. Many in our community have submitted fascinating questions for us to ask our experts. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're going to go through as many as we can. Remember, we're giving general guidance. So if you have a question about your health, we'd like to help you. So come in and talk to our fantastic Northwell physicians so we can answer your questions and give your health the attention it deserves. So let's get started. Dr. Dwivedi, we're so excited to have you today. Welcome.
Hi, thank you for having me. It's a pleasure to join, and hopefully we'll have a good discussion about coronary artery disease.
Well, we're going to have a great discussion. So let's start with something basic. What is coronary artery disease, and how does it affect the heart?
So coronary artery disease is a condition where the arteries that supply blood to your heart so it can function appropriately start to develop something we call plaque. And when the plaque can start off as mild, and when it gets to severe stages, it can lead to conditions like heart attacks, abnormal heart rhythms, and even sudden death in very extreme cases.
So what is a plaque? What is it made out of?
Plaque is basically made up of cholesterol. So when everybody has cholesterol in their body, and over time, if your cholesterol is high or if you have genetic factors that affect how your body handles the cholesterol can get deposited in the arteries of the heart. Imagine it being kind of like the pipes in your house, and when you get buildup or residue in those pipes. So similarly, when that happens in the arteries that supply blood to your heart, we call that plaque. Now, plaque initially is made up simply of cholesterol and some inflammation, and we call this soft plaque or non-calcified plaque. And over time, it becomes calcified or hardened. And that we'll be talking about a little bit later on in the talk as well. So imagine that it starts off like a soft-boiled egg, and over time, it becomes a hard-boiled egg.
What are red flags? When do patients immediately need to seek care?
Coronary artery disease can present with a spectrum of symptoms. In the nascent stages, it's often asymptomatic. And at the other extreme, when people have severe chest discomfort, difficulty breathing, lightheadedness or dizziness, that means that you need urgent attention and you should probably go see a doctor right away.
How do doctors diagnose coronary artery disease and its severity?
There's multiple different ways in which we can diagnose coronary artery disease. There's the gold standard way to diagnose it, which is an invasive procedure called an angiogram. Having said that, not everybody needs it. So we have non-invasive ways, which are stress testing and the coronary CT angiogram and the calcium score, which we'll also be talking today, which can help to identify coronary artery disease without the risks of invasive procedures.
Let's go through all of those tests in a little bit more detail. What is a stress test and what does it demonstrate?
A stress test is basically where we make a patient walk on the treadmill and we are essentially stressing the heart. So that can either be with walking on the treadmill or sometimes with chemicals or medications that we can give to the patient. And oftentimes we also image the heart during the stress test with either a nuclear camera or a sonogram or an echocardiogram. Now, a stress test is a great screening test. It gives what I like to say like a 10,000 foot view of what the heart condition is like. And a stress test is typically abnormal or will show findings if you have severe obstruction, meaning that if you have more than 70 to 80% blockage in the arteries of the heart, that's when a stress test is helpful in diagnosing coronary artery disease. Having said that, a stress test can also provide us with other useful information, like your how much you're able to exercise and if you have any symptoms or heart rhythm abnormalities when you exert yourself as well.
If you have a negative stress test, meaning that it's normal, does that mean you don't have coronary artery disease?
Yeah. So, like I said, a stress test gives you sort of a 10,000 foot view. It tells you whether you have a severe obstruction or a severe response of blood pressure or heart rate to exercise. But like I had mentioned before, coronary artery disease, especially in the nascent stages, can often be asymptomatic, or you could have a 40 to 50% blockage in your arteries that will probably not show up on your stress test. So while it's a good screening test, it doesn't necessarily tell us the absence or presence of plaque buildup or coronary artery disease in your arteries.
So if you have a negative stress test, sometimes we'll go on to a calcium score. Can you explain what a calcium score tells us?
A calcium score is a great screening test for coronary artery disease. We often recommend it to patients who are asymptomatic, meaning you don't have any symptoms, because we want to pick up the plaque buildup or the coronary artery disease before it becomes problematic or symptomatic. And a calcium score is basically a 5-minute picture of your heart. Imagine we're taking an X-ray of your heart, and it picks up the calcified plaque, as I had said. So plaque is non-calcified, and then it becomes calcified. So a calcium score picks up the calcified plaque, even if you're asymptomatic. And this can help us detect coronary artery disease in early stages so that we can treat it and avoid bad things like heart attacks and strokes in the future.
How do you interpret a calcium score? What does the actual score mean?
Calcium score, you essentially get a number. The perfect score is 0, which means you don't have any plaque buildup in the arteries of the heart. And the numbers range anywhere from hundreds to thousands. Obviously, patients who have calcium scores of thousands typically need invasive procedures and surgeries, but anything between 0 to 100 is considered mild. 100 to 400 is moderate, and anything above 400 is typically severe. And I just want to emphasize that this is only for patients who don't have any symptoms.
What about looking at individuals according to their age and their gender? Does that come into play in the score?
Plaque grows with age. So age is a big risk factor for whether you have plaque or not. Other factors that play a part in whether you build up plaque and develop coronary artery disease is your gender. Women typically develop it later in their lives after they reach menopause because estrogen is protective for our hearts. And also certain races like South Asian and Black populations are at a higher risk for developing coronary disease. So you really want to compare yourself to people who are at the same genetic risk and demographic profile as yourself. So an 80-year-old may have a little bit of plaque, and that's okay, but a 30-year-old having even a little bit of plaque is a big problem. So putting it into context of who you are and your genetics is very important.
So there's a question in the chat box about symptoms. What are symptoms of coronary artery disease?
Yeah, so typically anything that makes the heart work harder will typically bring on the symptoms of heart disease. So usually if you're walking and you develop shortness of breath, chest discomfort, dizziness, that's usually concerning for heart disease. Having said that, they can also occur at rest. So if you feel like you're having symptoms that are not ordinary or unusual for your body, it's always important to get these checked out because heart disease can present with a myriad of symptoms.
Okay, so let's talk about the asymptomatic patient again. If you had a calcium score 3 years ago and it was 0, When should you repeat it, or should you repeat the score?
Plaque buildup is a long process. It's really a marathon, not a sprint. It builds up over years and years. So you definitely don't need it on a yearly basis if your calcium score was 0. If you are high risk, meaning you have risk factors for heart disease like high blood pressure, diabetes, family history of heart disease, then you should probably repeat it in 3 years. If you are low risk, meaning you don't have any of these other conditions that I described, then probably you can have it at 5-year intervals.
Okay. What if your score was about 200 or high for your age and gender?
Coronary calcium score is a good way to detect plaque. And once you detect it, then repeating it doesn't really have any benefit, because once you have plaque, then you are typically going to be started by your doctor on cholesterol medication. And the cholesterol medication, what it does, it actually stabilizes your plaque or cements it down. And the way it does that is by calcifying that non-calcified plaque, because that's less likely to cause heart attacks and strokes. So sometimes your calcium score may even go up. So once you have some plaque buildup in your arteries, you don't need a calcium score again.
So once it's there, and we just need to treat it.
Absolutely.
All right. So what is a CT angiogram of the coronary arteries? How does it differ from a calcium score?
A CT angiogram is a calcium score plus another test which involves administering a dye through the veins to look at how the plaque is modeled inside your arteries. So the CT angiogram tells us A, if you have plaque, and B, how much obstruction or stenosis, as we call it in medicine, is the plaque causing. So is it causing a 10% blockage, a 50% blockage, or a 90% blockage? And that's what a CT angiogram shows us. I like to describe it as a non-invasive angiogram. It's basically telling us the anatomy of the blood vessels, the plaque, and how much obstruction the plaque is causing.
Okay. Can you explain how it's performed?
We typically put an IV in, kind of like when we take your blood, and the patients lie down in a CAT scan and they get a dye, and then it takes about 15 to 20 minutes. So it's not a long test, but it does require administration of a dye.
Okay. If you have an allergy to the dye, or if you have an allergy to shellfish, can you still have the test?
Yes. So if you have an allergy to the contrast dye in the past, or some other allergies that may conflict with the test, your doctor will typically prescribe you medication like prednisone or steroids and Benadryl so that we can safely administer the dye and you can avoid any side effects.
Great. So when would you send a patient for a stress test rather than a CT angiogram? Or vice versa?
They are very complementary tests. A CT angiogram helps us to find whether you have plaque and how much obstruction it's causing. But a stress test, on the other hand, is helpful for us to figure out how your body is tolerating the plaque and how it's tolerating the obstruction if you have any. So it tells us how much you're able to exercise and if your heart is okay while you're exercising, regardless of the plaque or the blockage.
Why would you send someone for a CT angiogram over a cardiac catheterization? Or when do you send a patient for a full cardiac catheterization?
So a CT angiogram is a great way to for us as doctors and patients to find out if there's anything severe that needs intervention. So it basically helps to diagnose coronary artery disease and figure out how much obstruction you have without the risks of an invasive procedure. So an angiogram is an invasive procedure where you have to be put under some sedation and we put a catheter up to the heart. It's a great test and it's really the gold standard for diagnosing coronary artery disease. But as we all know, every invasive procedure comes with its own risks and complications Having said that, they're minor, but they still exist. So if we can avoid doing that by just getting a CAT scan and telling you, okay, you only have a 10 to 20% blockage, you don't need an angiogram, that's great. On the other hand, if you have a 80 to 90% blockage and you're having symptoms, then we can be sure that the test you're getting as the next step is really the appropriate test.
When is a stent needed? When do you need to put in a stent?
A stent is typically needed if you have a very severe blockage, more than about 80 to 90%, and we see that it's obstructing flow of the blood. Or if you're having symptoms and we find anything that's about 70% or more blockage.
One topic we didn't cover is radiation. Do we need to worry about radiation with the CAT scan?
Yeah. So whether you're getting an invasive angiogram or CT coronary angiogram, both of them administer radiation. Obviously, it's important to limit the radiation. And, initially, like 10, 20 years ago, the radiation was a lot higher. But fortunately, with newer technology, we've actually been able to cut back the radiation to almost 10% of what the scanners were doing about 10 to 20 years ago. So having said that, you don't want to get yearly CAT scans, but I think the benefits of getting the CAT scan are great enough that the minimal radiation is worth the risk.
Okay. So there's three possibilities when you get a CT angiogram of your results. You don't have any coronary disease, you have non-obstructive coronary artery disease, and you have significant blockage. So if you have significant blockage, we talked about going to the cath lab. What is non-obstructive coronary artery disease, and what do you need to do about that?
Yeah, so non-obstructive coronary artery disease is basically that you have plaque buildup in the arteries of your heart, but fortunately, it's not causing any issues to the blood supply to the muscle of the heart. So your heart's able to function appropriately and regardless of the plaque buildup. And this is really where the coronary CT angiogram and the calcium scores are a game changer, because this helps us to diagnose coronary disease before it becomes problematic, before patients need invasive procedures and stents, and we can put you on appropriate medications. Typically, these involve cholesterol-lowering medications. The common ones are statins. They help by lowering your cholesterol, because we know plaque is made of cholesterol. And the other thing they do is they actually change what the plaque looks like. So they stabilize it, and they help to form the plaque in a more sort of a cemented down way so that it doesn't break off and cause heart attacks and strokes. Sometimes based on how much plaque you have, your doctor may even prescribe you a blood thinner like a baby aspirin, which can help prevent heart attacks and strokes as well.
There's a question in the chat box about carotid Doppler ultrasounds. Can you explain what a Doppler ultrasound is? And if you don't have plaque in your carotid, does that mean you don't have coronary artery disease? Are they correlated?
A carotid Doppler is a technology by which we use a sonogram, similar technology what we use to look at babies in the belly, to look for any plaque buildup in the arteries that supply blood to your brain. If you don't have plaque buildup in the arteries of your carotids, then it doesn't always necessarily exclude coronary artery disease. Also, calcium scores in studies have shown to be more sensitive at picking up plaque. So one doesn't necessarily negate the other. But if you have plaque in your carotids, the likelihood that you have plaque in the arteries of your heart is also usually pretty high.
If you have a negative and normal carotid ultrasound, you would still recommend getting a calcium score for
Correct.
someone at risk. Okay. So we talked a little bit about statins. What about diet and exercise? If you have non-obstructive coronary artery disease or even coronary artery disease, does diet and exercise alone lower your risk, or do you need medications?
Diet and exercise are important regardless of whether you take medications or not. It's taking medications is not a free pass to just eating whatever you want and not exercising. But once you have plaque buildup, Most of the time, diet and exercise alone are not enough because the statins, like I said, they actually work on the plaque in and of itself to stabilize it. And that benefit, while it exists a little bit with good diet and exercise, is minuscule as compared to how much the statins can help you. So typically, once you have plaque, your doctor will probably want you to be on a medication to help prevent the plaque from getting worse.
Because what happens in a heart attack? In a heart attack, you have plaque that's non-obstructive and it pops off like a pimple that pops, right?
Exactly. So, the heart attacks are basically when the plaque breaks off and there's a huge clot that forms in the arteries of your heart. And the statins and a little bit also the baby aspirin help to prevent this process from happening and prevent any bad, things that take you to the emergency room, let's say, right away from happening as well.
It's important to listen to your body, and if you have symptoms, react to those very quickly.
Yeah.
You spoke a little bit about diet. Would you like to talk a little bit more about what is a healthy diet?
Yeah, absolutely. So I think, again, I want to preface again that regardless of whether you have plaque or don't have plaque, a healthy diet is important. And, a heart healthy diet typically is high in fruits and vegetables, which obviously have a lot of nutrients, antioxidants. They're also lower in calories and the bad cholesterol, which builds plaque in your arteries. When it comes to meat, you want to avoid red meat like beef, lamb, and pork, because again, they increase your risk for developing plaque because they're high in the bad cholesterol. If you like to get your protein from non-vegetarian diet, you probably want to stick to seafood, which is healthy. Fish has a lot of good cholesterol or healthy cholesterol. Lean parts of chicken, turkey are healthy. And then when it comes to carbohydrates, you want to stick to whole grain. So anything that retains its shell around it. So brown rice over white rice, quinoa is healthy. Oatmeal is a great breakfast food that you can incorporate into your diet. And then obviously avoiding bad habits like excessive drinking, smoking, and also avoiding a sedentary lifestyle, which goes a long way.
So both medication and a healthy diet
Yes.
and exercise plan is so important if you have coronary artery disease. So one last question. If you had one action step to recommend to our viewers and start today to improve their health, what would it be?
I would say know your numbers. It's important to get educated about your health and understand what your baseline status is and how you can improve it. So when I'm talking about numbers, I'm talking about your blood pressure numbers, your diabetes numbers, your blood sugar levels, and last but not the least, your calcium score, which helps to tell you how much plaque you have and how you can prevent it from getting worse in the future.
Yes. So thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to our guest, Dr. Dwivedi, for joining in our conversations. We appreciate her ability to educate, encourage, and empower our community. As part of our community, we hope you'll share in our mission and pass along our emails and webinar links to your friends and family. In addition, please like and subscribe to our YouTube channel. We have topics from diabetes to knee pain. We know you have additional questions about your health and we'd like to help you. So come in and speak to our extraordinary Northwell Health physicians about your health. We care about your health. We care about you. Thank you so much for joining us today.